Two local lawmakers have officially filed legislation meant to protect you from drug-addicted healthcare workers, and they say our community watchdog investigation prompted their action. Good evening, I'm Sarah Diamond.
I'm Josh Smith. Just months after Nate Morabito uncovered a state failure that allowed drug-addicted nurses to keep their jobs, find new jobs, and put more patients at risk, lawmakers have come up with a proposed law to fix the problem. And it doesn't just single out nurses.
Yeah, the Tennessee Nurses Association welcomes this change. This bill right here, sponsored by Senator Rusty Crowe and Representative John Holtzclaw, targets all licensed healthcare workers. We're talking about doctors, dentists, pharmacists, nurses, and others. The legislation would require emergency action by the state to temporarily pull those workers' licenses if they fail a drug test.
This is very eye-opening.
Representative John Holtzclaw says he couldn't believe it when he learned drug-addicted nurses were able to find new jobs while under investigation for suspicion of drug diversion.
That was very disturbing to me because my mother spent a lot of time in the hospital.
The Elizabethan lawmaker is now sponsoring this bill. If passed, it would temporarily suspend the licenses of nurses and all other licensed healthcare workers if they fail a drug test and can't show a prescription that proves the drug is medically necessary.
We want immediate suspension of their license, no time delay.
It's something that needs to be taken care of.
Senator Rusty Crowe started pushing for a solution several months ago.
It's really shocking to me to find out.
After hearing the results of our investigation, we discovered it took the state more than a year on average to suspend local nurses for drug diversion. It took more than 2 years for this former nurse to lose his license. The Tennessee Nurses Association helped shape this legislation.
We are very concerned about patient safety and the growing problem of addiction among both healthcare providers and the population at large. We're also very cognizant of the need for due process for individual practitioners. We have been working with Senator Crowe on this bill. The work is not done yet.
Lawmakers plan on working with each profession to make sure every person impacted is guaranteed their due process rights.
It's the right thing to do. You know, if you save one life, this is well worth it.
They hope the end result is a simple solution to a complex and dangerous problem. Nate Morabito, News Channel 11, in your corner.
After a failed drug test, the legislation also would allow for a licensed healthcare worker to possibly be eligible for probation instead of suspension if they enter an addiction treatment program.